This is chapter 21, talking about toxicology. So every single day, we're exposed to things that could be potentially poisonous, no matter what we're doing. A good portion of things that we're exposed to just in everyday life have the ability to become poisonous under certain circumstances. And different doses of that can turn into poison for somebody, like aspirin. Some people take aspirin every day. Others, by taking just a small amount of aspirin, can actually overdose based on the way that their body handles it. Acute poisoning affects about 2 million people each year, and we're not talking about kids. We're talking about just random people that become poisoned by something that they've been exposed to. However, chronic poisoning is much more common. Um, there have been repeated people that expose themselves to the same substance either through work, etc., and you just kind of become complacent about the um, risks associated, and so you kind of poison yourself a little at a time. It can be that suicide is becoming almost normalized in our society nowadays, and people are turning more and more to medication induced. Some is that people have less coping mechanisms than are necessary to lead everyday normal lives, and so they turn to substances and oftentimes need increasing doses to get the same effect, and then all of a sudden they've overdosed on it. Deaths that are caused by poisoning on the grand scheme of things are still relatively rare, um, especially compared to what they used to be. The rates of death for children have decreased drastically since they came out with child proof caps or child resistant caps. However, if I can't get into my medication, I certainly know that handing it to my 13-year-old, she's going to be able to get into it, and she's been able to do that for years. So it was more little ones. I still think my 4-year-old can't get into them. And again, think being the go-to word there. But on the flip side of that, because of emerging drug abuse utilizing different forms of medications, not just some of those street drugs, there's been a rise in adult deaths. Toxicology is the study of a toxic or poisonous substance, and a poison is any substance that the chemical action can damage body structures or impair body function. A toxin is the actual poisonous substance that produced by bacteria, animals, or plants that act by changing the normal metabolism of cells or destroying them. And your toxins can have either an acute or chronic effects. Substance abuse is the misuse of any substance to produce a desired effect. A common complication of substance abuse is overdose. This is when a patient takes a toxic dose of a substance, and the fact that as you continue to utilize a substance, you need to take more and more and more to gain the same effect, and there's no true dosing like there would be for medications that you're prescribed, or it could be taking prescribed medications at a much higher dose than they are prescribed. Here's a couple of different specific overdoses. Opiates is definitely something now that has come into light, and more people are utilizing pills. Sympathomimetics, they mimic the sympathetic nervous system, those that control your fight or flight. Cocaine, methamphetamine are the street drug types, but even taking too much albuterol can overdose somebody on a sympathomimetic. Sedatives or hypnotics, people are taking these medications for depression and anxiety more and more. They used to try and keep people off of them as much as possible, but they're becoming more frequent, unfortunately. Anticholinergics, you can overdose on Benadryl. So this is what that kind of looks like. And then cholinergics, typically cholinergics are going to be organophosphates that are used in farming, at least in this area, where they got exposed to it accidentally. It wasn't a intentional overdose. But you have this table in your book, and then the discussion question for next week will have to do with this as well. So definitely utilize these resources. So when you're talking to your patient, the first thing is to determine that the patient has been poisoned. Recognizing that a poisoning has occurred is sometimes difficult. For our safety, we have to pay attention to our surroundings. We want to make sure that we don't get exposed to the same substance. Even, some very, very small amounts of a substance can cause significant damage or death. So it's important to keep that index of suspicion high. If you've got one person or multiple people in the same area exhibiting similar signs, that should say poisoning or toxic event to you. The signs and symptoms of poisoning are going to vary according to whatever the patient was exposed to. If you have a presence of injuries around the patient's mouth, that definitely suggests that they have ingested something. If possible, when you're taking sample, ask a couple of extra questions. So what substance did you take, or what were you exposed to? When did you take it? How much did you take? Did you have anything to eat or drink before or after you took it? Have you been given an antidote or any other substance orally since you ingested it? And then trying to get an accurate weight. A lot of things are going to be weight based, as far as they took this much, they weigh this much. Here's the potential for overdose for them. A lot of medications are weight based. Try to determine the nature of the poison. So you want to look around for overturned bottles, needles, syringes, any sort of scattered pills, chemicals. There can be like plants or something. Just look at those things. Try and have police on something like this with you. If you have something that looks like an overdose, it's best not to roll in on this by yourself. You should keep yourself safe by having somebody else come with you. This says take any suspicious material with you. If you have PD on scene, let them worry about that. You worry about the patient. Containers at the scene that can provide critical information, such as a pill bottle that they said that, yes, I've taken this. You may want to take that with you because it helps determine how much they took. If there's a number of pills that were originally in that package and the prescribed dose, and they can count what pills are left, if there are any left, and kind of determine where the patient should be at and how much they took. If the patient vomits, take a quick look at it for pill fragments. May or may not be a consideration. Make sure you're wearing proper PPE with somebody that's had an overdose, because the chances for them to throw up are pretty high. And then note anything unusual that you end up seeing. Poisons enter the body several different ways, and your treatment of that is going to depend on how it got in. Our general treatment can range anywhere from just talking down somebody that's anxious because they realize that they've taken this medication or taken too much, and it can go all the way to performing CPR. Um, we do have a medication that we give patients that have opioid overdoses that it's called Narcan. It's used to reverse the effects of opioid, and this is the most common pre-hospital antidote that we have. Um, However, for the most part, we don't do a lot of antidotes just because a lot of poisons are just everyday um, chemicals that really don't have an antidote to them. It's only toxic because of the amount or the way that the person was exposed. Either way, definitive treatment can only be provided at the ED, so we're going to promptly transport irregardless. The most important thing that any of us can do pre-hospitally is to dilute the poison or by removing that poisonous agent. So sometimes that's going to be getting the patient out of the area, such as in the case of like carbon monoxide poisoning. Removing them from the area is the most important thing so they don't continue to get doses of that carbon monoxide. We do decontaminate because we don't want anybody else to get contaminated with it first and foremost, but then getting that off of the patient's body, any sort of chemical, removing it, can help with how much the patient is exposed to. There's 4 routes to consider as far as how poisons enter the body: inhalation, absorption or surface contact, ingestion, and injection. And here's pictured representations of all of those things just in case. All 4 routes of poisoning can lead to very serious, possibly life-threatening conditions. So we need to treat patients appropriately after making sure that we've kept ourselves from harm. If at any time you are not sure what to do or how to treat a patient that's been poisoned or exposed to a specific substance, if you know what they were exposed to or you have an idea of it, you can always, always, always contact medical control, or even more importantly, poison control. Poison control is not just for the general public. We utilize poison control all the time because, I mean, there's several, wives' tales about, well, if you have this, take this, or the people at Poison Control Center, A, they're there all the time, and B, they have several different algorithms of evidence-based practice that help you take care of the patient in the best way possible. Even if you know what's going on, you give them Narcan, etc., sometimes it might be good just to throw a phone call into Poison Control so that you make sure you have all of the necessary information. We'll talk about the specific routes. So inhaled poisons: if the patient has inhaled some sort of poison, move the patient to fresh air immediately. The patient may require supplemental oxygen because it's come through that respiratory tract and could have caused damage on the way in. If you suspect the presence of a toxic gas, you may want to call in your hazmat team so that they can get that under control, and they can also test to see what that gas is. Some patients will also need decontaminated by the hazmat team. You definitely want to remove clothing because it may contain trapped gases. You may need to spray them down, and there's specific protocols for how to do that. The patient may have any of the following signs and symptoms: burning eyes, sore throat, cough, chest pain, hoarseness, wheezing, respiratory distress, dizziness, confusion, headache, and stridor in very severe cases. If they've inhaled something, they need to be transported immediately. You're going to probably end up supplying oxygen, keeping a pulse ox reading on them, and have a suctioning unit available. Some patients use inhaled poisons to try and commit suicide in vehicles, so they'll leave the car running with an enclosed garage because that traps exhaust fumes that has high levels of carbon monoxide. So when you open the door, you want to make sure that you get back out of the way so that it can air out before you go in with the to check on the patient. hazardous materials, people have respirators, might be a